Sciatica. You've heard the word, and whether or not you've experienced it, you might not know exactly what it is or how to help yourself manage and treat it. Keep watching for 3 starter solutions to combat the nasty nature of sciatica, and please share this video with any deserving people. Sciatica is a compression of the sciatic nerve. Branches from here, go down. Spinehealth.com lists a number of different descriptions of what you might experience, including constant pain in only one side of the butt or leg, but rarely in both sides. Pain, typically described as sharp or searing rather than dull. A pins or needle sensation, numbness or weakness, or a prickling sensation down the leg in some cases. Also, weakness or numbness when moving the leg or foot. Severe or shooting pain in one leg, making it difficult to stand up or walk. There's also pain and other symptoms in the toes, depending on where the sciatic nerve is affected. And lastly, lower back pain that, if experienced at all, is not as severe as the leg pain. And if you're wondering if you're too young to have it, I just had a 23-year-old student coming to see me with previously debilitating back spasm, which are now reduced to alternating leg numbness or tingling sometimes. And he's 23. Now, Stats Canada, they confirm what most people feel. 80+% of Canadians will experience some form of back pain in their lifetime. Now, it's not clear how many will manifest into sciatic pain and problems, but this is a substantial figure not to be ignored. You're not alone, and it's crucial to not let this suggest to you that there's nothing that can be done, because there is. There are a number of possible causes of sciatica, okay? Spinal stenosis, narrowing in the lumbar spine, tension or spasm in the piriformis muscle, lumbar disc herniations or spinal degeneration, and sacroiliac joint dysfunction. That's these guys. Now, in my professional opinion, after more than 14 years and many sciatica cases presenting themselves, the most prevalent causes relate to lumbar spine misalignments, which may or may not have disc herniation or degeneration involved, and SI joint dysfunction, as I just pointed out. The reality is that sciatica is quite treatable, and in many cases does not need surgery or heavy medication. Yes. But if you're not quite ready to seek professional help outside of the medical realm, that's okay. Here's 3 options to do yourself to help with the pain and discomfort that you might be suffering with. Number 1, cryo-ice therapy. Now, it has to be applied correctly and consistently, but this natural anti-inflammatory won't negatively impact on your organs, the toxic side, like its pharmaceutical counterparts. You want to do approximately 15 minutes per session, and a soft or frozen gel pack, frozen peas works best, with a protective fabric like a t-shirt, a kitchen dishcloth, or similar thin fabric to ensure you don't freeze or aggravate the skin. Applied every hour is safe. And for those having trouble falling asleep, lay on your back, put your knees slightly elevated, and use cold therapy right in bed. The temperature effects will wear off without overcooling you. Where? Your lower back. Remember, the nerves that join to create your sciatic nerve come from your lumbar spine, and this is where any inflammation will be the biggest problem. Second option, yoga therapy or gentle stretching or foam rolling. Now, they're not for everyone. Those with more severe inflammation or muscle tightness / rigidity, they may have a negative response. Newer cases, meaning a few months or less, they might benefit from stretching and decompressing the lower back, the piriformis muscles and the hip flexors. All muscle groups get restricted from sitting or being static all day, and let's face it, most of us can unfortunately identify with sitting a lot through the day. Now, if you're that case, where you feel better when you move, but you feel worse when you stop, you have tight and tired muscles, and this should help you. Now, when using a foam roller, be gentle and expect some initial discomfort before any relief sets in. You'll want to talk to a yoga instructor in a class about your level of sensitivity and incorporate any bolsters or any modified poses to avoid any overstimulation. Stop all activities If they cause any weird aggravation or your symptoms come back, remember, an inflamed state is already stretching and irritating the nerves, so some people, they truly don't respond well to these efforts. Last one, gentle strength training. Now, when the muscles are tight, they're also generally weak. And without enough power and endurance, a muscle is simply going to stay tight. You want to focus your attention on your bum, your glutes. Now, they're meant to support you in your upright posture much more than your back is. You also want to focus on your core all the way around and make sure that abdominal stimulation is a part of your regime. Think about exercises like planks and hanging knee lifts versus the traditional sit-ups, which might cause more stretching and more aggravation. Your hamstring muscles, they tend to be weaker than the quadriceps as well, so make sure you give them some love. Don't hesitate to ask any questions in the comment section below if I can suggest something or give you more clarity. And once again, don't forget to share this video with people who may be suffering too.